Hello, everyone, and welcome to a brand new episode of the Untold. My name is Fatma Al-Awadi, and with me is Dej Al-Hotri. How are you, Dej?
I'm good, thank you so much, Fatma. And of course, welcome, dear viewers, to a brand new episode of your show, The Untold. So, again, like as usual, every day
We have
we
a
get
guest.
a guest, definitely. And today
Today-
we're going to meet Dr. Saad Almasab,
Yes,
right?
yeah. Today, Dr. Saad said he was going to talk about not just the physical family medicine, but also the mental
health. All right.
Exactly. And we know this is a very important subject, and we appreciate guests like Dr. Saad, so we can't wait to start this episode. We will see you with Dr. Saad Almasab. Hello, everyone, and welcome. We are here with Dr. Saad Al-Masab. And Dr. Saad, how are you feeling today?
I'm good. Thank you. Thanks for having me.
Thank you
we're,
for being
We're so happy to have you here with us. Yeah.
It's
Yes.
my pleasure. Thank you.
Thank you. And if you could please, as a start, tell us about your background and what got you into the family medicine.
Okay, so like about my professional background, I studied medicine, of course, and then I graduated about like 9 years ago. And then I got into Family Medicine Board, the Kuwaiti Board for Family Medicine, which I finished about 2 years ago. And I had a special interest in mental health. So that led me to acquire also a master's degree in the psychology of mental health.
MashaAllah.
And I also am trained in psychological therapy, like cognitive behavioral therapy, which is used for depression and anxiety. And just recently, like about 3 to 4 months ago, I finished training in a form of therapy called compassionate inquiry. It is a form of therapy that can be used for counseling patients with physical and mental illnesses.
Nice.
Yeah.
So, is there like a specific experience or story behind you taking that decision of becoming a doctor?
To be honest, like to be completely honest, when I decided to become a doctor, I was like 17 or 18 years old. So there wasn't really, I wasn't really too passionate about it. I graduated high school with good grades, and my family were very supportive at the time. They were very supportive of my decision going into med school. And since I was very young as well, they kind of planted this idea of me becoming a doctor. So I didn't really have passion before I got into medicine, but I developed the passion afterwards.
Was it also in the same, was it the wrong passion of the right field or the right passion of the wrong field when you were talking just now about getting into family medicine, and then you started appreciating, mental health medicine, let's say the field? Do you think you would go back and become a mental health professional?
Actually, I like what we do in family medicine, because in family medicine we adopt something called the holistic approach to health.
Yes.
Which is based on combining the social, psychological, and physical aspects to health. And the holistic health is most well integrated in family medicine compared with other specialties.
Oh.
So I do acknowledge that I got into family medicine. I wouldn't like change my decision of going into family medicine because I'm really passionate about it, actually. And I think it is easy to combine any other specialty with family medicine. So a lot of my colleagues who do family medicine, they have also special interests in other things like dermatology or sports medicine or geriatric medicine or mental health.
Yes.
Yeah, like myself.
It's very challenging, though, especially getting into any field of medicine. It is well known that it's a bit challenging. What are the
difficult,
challenges? Yes. And what are the challenges that you have faced during your medical journey?
Yeah, like of course it's not easy. Like it's really not easy. especially the first few years of doing medicine. Um, a lot of people struggle with these years because the exams are very difficult. Medical training itself has a lot of requirements. There are a lot of expectations, and so it's not really easy. But if you're interested in it, it becomes easier. If you're willing to learn, it becomes easier. And I feel like there are other things that make it easier, like prioritizing, organizing your time, studying with friends. There are a lot of things that can make it easier.
This actually applies to English, right? So if you love English, you can learn better and faster. Do you agree with that?
Yes, I agree. And speaking of English and medicine, when we teach actually special fields, you know, like engineering, but for English, you know, tourism, but for English. When it comes to medicine only, we actually take a course on how to teach medicine for English like for people who want to speak English in the medical terms, because most of them know it by English.
Yes.
You know, like you can have a secretary who works in a, you know, as a managerial field, but she doesn't know English. But for when it comes to doctors and medicine, it's all Latin and English. So we take a course of how to, us English trainers, how to reach the point or deliver the message of medicine in English. Yeah, that's difficult.
That's very difficult. That's why the questions here and there, the challenges and all of that goes all together.
Yeah.
Now, when it comes to family medicine, there is a quite wide range of health issues, right?
Yeah, that's
so.
True.
What aspect of this field do you find most rewarding?
I mentioned earlier the holistic approach. I find it very rewarding, to be honest, because I do believe that our mental and physical sides are not separate. They're interconnected. They're part of one, different parts of one thing. So in the holistic approach, we use something called the biopsychosocial approach. So we acknowledge the physical side to health. So if a patient, for example, has a medical illness, we consider that, but we also have to consider the mental side. Is there like stress? Is there any anxiety? Is there any depression? What's the patient's perspective? What's the patient thinking about their medical condition? Also, we consider the social aspect, because for many people, their physical illnesses can deteriorate because of psychological and social reasons. So that's one thing that makes family medicine to me very appealing.
Yes.
Also, the idea of continuity of care, which we find almost only in family medicine, where each patient can follow up with the same doctor. And our patients, for example, we know them by name, we know their families, we know their background. So there is like a close proximity to patients compared to other specialties. The environment in the family medicine clinics is much more friendly than other, than going to the hospital.
To a hospital.
Yes, yeah. And of course, you were talking, Dr. Saad, about a lot of people get into family medicine and sometimes they would add more to their experience, let's say dermatology or geriatrics or so on.
Yeah.
Why did you choose mental health? And we're glad you chose it because apparently you're perfect at it. But what made you choose mental health and what was the process of your thought?
So what made me choose mental health was an experience that I personally went through. And it was not an easy experience. But I'm choosing to share it now because it's one of the things that could possibly kind of break the stigma around mental illness. Just a year after I graduated, I developed a lot of anxiety, particularly social anxiety and panic attacks. And it's very difficult now talking about it, but...
Thank you for mentioning it, by the way.
So it was a very difficult time for me. But because I'm like a healthcare professional, doctors sometimes can be the worst patients. So I did not seek for help back then. I wanted to just throw it under the rug and move on, you know. But it kept getting worse. And eventually I also started having physical symptoms in my gut, which led me also to do an endoscopy, which found that I had some gut issues, like bleeding ulcers and inflammation in my gut. So this was a very profound experience, to be honest. It made me reconsider a lot of things, and it made me think of the connection between our mental and physical side, and the fact that they are interconnected. They are so much related to each other. The problem with our current practice of medicine, it's actually based on the idea that they are separate.
Oh, I see.
Yeah.
Yeah.
In medicine and med school, we kind of separate mind and body, and that makes it easier to study each of them. But even in practice, we kind of separate them. Like if a patient goes to a hospital with a regular physical symptom, the patient will not be asked about their mental health. They will not be asked about their social life.
Only about the specific...
Exactly. Just a very minority of doctors who are going to ask, only doctors who are interested in this holistic approach.
Okay.
So this experience, even though it's difficult, it made me, it kind of taught me a lot about how connected our minds and bodies are. And it kind of made me more interested in health-oriented medicine rather than disease-fighting medicine.
That's why the holistic approach is
Exactly.
something that you believe in, because I think they, I don't know if it's true or not, you have to correct it for me. When you're sad, your lungs get affected. When you're angry, your gut gets affected. When you're stressed, your
Is that
hair.
right?
Or I think there's each
There's a
part of our
connection?
body. There's a connection to your mental health. Is that true?
Scientifically, that's actually not so true.
Okay.
But if you go back to old ancient medicine like Chinese medicine and Ayurvedic medicine, they do believe in the effect of emotions in certain parts of our bodies.
Okay.
But when it comes to the medicine that we practice, we do not actually consider that this
You
is
don't
true.
connect each one.
We do
It
not
doesn't.
connect it that way.
Okay.
But there is scientific evidence, for example, that our emotions directly affect our gut microbiome, which is the bacteria in our guts. So if we have certain kinds of emotions, like you mentioned, sadness or anger, it will directly affect the bacteria.
In a bad way.
In a certain way, yes. Also, for example, there is another way in which the mind and body are connected is when we have prolonged stress for a long while. It increases a hormone called cortisol. And in patients who have diabetes or high blood pressure, this could raise their blood pressure and diabetes. So there is a connection between emotions, thinking, and our bodies, and it's very well established, but it's not so integrated in our system yet.
So it needs more studying in this matter to get
true.
to know more about the connection, because there is mental, physical connection somehow, but of course there has to be more
Study.
study.
Yes, so people should not be ridiculed when they go to a doctor and say, I'm very stressed, I think, something aches in my body, or I'm very stressed, I cannot go to work. And they'd be like, oh, just, be positive and nothing's going to happen. That's not the way to approach it, and this is what Dr. Saad is talking about. This is actually a legit problem that we have to solve.
Yeah,
Yes.
it is. I agree, 100%. And whenever a patient comes with this kind of complaint, if we choose to use the holistic approach, we're going to kind of get to the root of the problem.
Oh.
Yeah.
How so?
Like if someone comes with this kind of complaint, for example, we'll ask certain questions that address why the patient is... What was the complaint? You said, what was the complaint?
Oh, sorry, I'm stressed, let's
I'm
say.
stressed.
Yes, I cannot go to work anymore because I'm very stressed.
Okay.
Sometimes it happens to...
So what's the reason for that stress? We're going to be inquiring into that.
So we're
What's the
gonna
reason
dig
for it?
deeper into what happened and the
Yes,
background.
because the stress could be physical, it could be psychological, and it could be social as well.
Wow.
Yeah.
Well, we actually have more questions, and right now it's time to take a quick break and then get back to you, dear viewers, with more questions with Dr. Saad. All right, welcome back, dear viewers, and we are back again with Dr. Saad. And right now, let's now talk about how can you integrate mental health care into your practice as a family physician.
Yeah. So, as I mentioned earlier, as part of our training is the use of the holistic approach. So, whenever a patient comes with any complaint, really, we do consider this approach. So, we do ask about their mental health. We do, especially for patients with chronic diseases, for example, because a lot of them do have some stress or some anxiety that needs to be addressed. Also, we do a lot of screening. So if we suspect that a patient has anxiety or depression, we have certain tools to screen for such conditions. So it is pretty much part of what we do on a daily basis. Yeah.
And speaking about mental health and also physical health, we know it's important to address these issues. However, why is it important to address them in a holistic manner?
Yeah, because as I mentioned earlier, our minds, our bodies are not separate. They are one of each, like they are one unit.
But can't we go for conventional methods instead of holistic methods?
The holistic and the conventional are not going against each other.
Okay, but which one do you prefer? Sorry, I have to ask.
I prefer to combine them.
Okay.
I prefer to. Conventional medicine is amazing. Western medicine is amazing.
The Western, yes. Yeah.
I really acknowledge it. And for example, if I have like a medical issue, I want to be rushed to a hospital for sure. But is there room for improvement? Yes, I think there is room for improvement. Can we make it better? Yes, we can make it better.
This is where we go to the holistic manner of things. Okay.
And when we just treat patients as broken machines, for example, just physical diseases, and their minds and their social life is not interconnected with that, I don't think that's the whole picture. I think we're missing something if we just treat them as just physically ill people. Integrating the other parts is very necessary. Yes, we still have a lot of, as you said, we still need more studies on that. We still need more integration of that into our practice. But I think it's coming. And this is not just what I say. There are a lot of people, a lot of doctors who talk about this. For example, Dr. Andrew Weil, who's the developer of the integrative medicine program in University of Arizona. He talks about this holistic approach, and there is a whole program around it for healthcare professionals. Also, many other doctors, for example, Dr. Amaran Mayer talks about the mind-gut connection and how our minds and gut are very interconnected. Dr. Gabor Mate, who I received training from in the compassionate inquiry training, also talks about how our biology, our psychology, our social side, our relationship are so interconnected. So
basically, in the end, you get to see what's the best for the patient.
Or yes, the result that each manner brings.
If I want to give you like a real life example. if a patient comes with high blood pressure,
Okay.
and we treat them medically, we give them a tablet, for, of course, to treat their high blood pressure. But also we have to address other things, like are they sleeping well?
Okay.
Are they eating well? Are they exercising?
This is the holistic manner when it
Exactly.
comes into, okay, I
Exactly.
understand now.
And then do they have stress? A lot of patients with high blood pressure, we treat them medically, they come back again and still have a little bit of a high blood pressure. And when we ask them, for example, about sleep, about stress, we find that they have high stress and their sleep is not so good. When we treat this issue, their blood pressure kind of normalize, it becomes better.
I see.
Yeah, so it is connected.
It is, yeah.
All right. So, Doctor, now I have this question. It's about social media. So, do you think actually social media plays any role in health awareness?
I think it does, yes, of course. And social media has been used and it's still being used to kind of break the stigma around mental illness. A lot of people are sharing about their stories, for example, in social media. Social media can be a source of information, but the problem, it can also be a source of misinformation. And also we need, since we're talking about mental health, we need to be aware of social media addiction, for example, because it's real. We all can be,
I don't know why he looked at me when he said that. I think he knows.
Yeah, probably.
Yes.
I personally think we're all addicted to social media somehow.
We spend a lot of time scrolling down.
Yeah, and the thing is, the apps themselves are designed to be addictive.
Addictive.
Oh,
Yes.
wow. Yeah.
Yes.
And but you know, when it comes to social media, I mean, our producers, they know Dr. Saad from social media, and they're like, why don't you come and talk to us about that? So sometimes it has a positive reaction.
Impact,
Yes,
of course.
yeah. Now, when it comes to raising awareness about mental health, of course, it's very important. Can you share with us and our dear viewers some of your personal or professional experiences about raising awareness for mental health?
So the story that I mentioned earlier, for example, is one way of kind of trying to raise awareness. Also in my career, for example, in patients who come to my clinic, but they feel unsafe about going to a mental health clinic or a mental health facility. There is a lot of stigma around mental illness. We have to be aware of that. In our society, a lot of people do suffer from anxiety and depression and other mental health disorders, but they choose not to seek help. They choose not to go, to see a professional because of this stigma, because of this social pressure that they feel, because of the lack of safety that they feel. So I feel like we need to work as healthcare professionals and people in the society as well. We need to kind of collaborate in breaking this stigma, this barrier.
Yes, yeah. I agree, and it can be as easy as, you know, sitting down here on this TV show and talking to a health professional who can actually tell us about how to raise awareness for mental health. And do you think it was only from the old-fashioned people or the older generation, or does it also go the stigmatization?
It applies
It's so much worse in the older generation. That's true. Yeah, there is so much resistance in older generations about seeking help.
Yes.
Yeah.
But it's also in the new generation, you're saying?
It is still, yes, it is also in the new generation, but it's so much less in the new generation. The stigma is getting like less and less.
Perfect.
Do you think that maybe in the future there is a way to develop this situation where you don't just go to the doctor, you can just text him maybe or something? Maybe the people
that's what I do with my best friends.
Yeah.
Right?
My best friend is my therapist. I'm sorry. No, I'm not supposed to say that. Okay.
It's happening now. There are a lot of platforms where you can actually virtually talk to a therapist or to a doctor. So it is happening.
Yeah, I think because people are afraid to show up more than, it's okay for them to text or to tell everything, their stories, their issues to to a phone rather than being in front of someone.
I mean, I would like to have someone who is a
That-
little embarrassed to be seen, but they know they need this mental help, or I'm sorry, to seek professional mental professional, sorry, rather than someone who says professional mental health, seeking that it doesn't exist and you shouldn't be going there. I would rather the first, who
Of
is a
course.
little bit embarrassed,
Yeah.
because they would break it, step
Yeah,
by step.
exactly.
It's better than not having anything at all and believing it
Well, it's
doesn't
just
make
a
sense.
way for
Yeah,
those
yeah.
who are afraid. But yeah,
Yes, yes,
definitely,
you're
I
right.
agree with you as
Yeah.
well.
Yeah.
So, and when it comes to medical professions now, professionals, sorry, how can they leverage social media to improve public understanding of mental health issue? Like, how do you think they should be preparing their content?
They can basically use social media as a platform. They can address the barriers and the stigma around mental illness in social media, because nowadays everybody's on social media, especially the younger generation. Also, like virtual platforms can be used for group support, for example. And I'm aware of one non-profit organization in Kuwait that organizes support groups for people with mental health disorders. I
Nice.
cannot remember the name though, but it does exist. So social media platforms can be used in that way for sure.
Wow.
That's very nice.
Yeah, and we talked about the misconceptions of mental health and the stigma and how you encounter them and how you reply to them or address them with your patients. Can I steal your question
Yeah,
and
go ahead.
say
Yeah,
yes?
go ahead.
Yeah. Oh, thank you. Because we just talked about it. It was. Can you share a success story from your experience where you were actually the professional who was giving the pieces of advice for someone who got better through mental health direction?
Yes, there are a few examples that I can remember in my clinic. There is one patient, for example, as I mentioned earlier, with high blood pressure and came with a lot of anxiety. And I diagnosed her with moderate anxiety, and she was refusing to take an anti-anxiety medication. Thankfully, in our clinic, we have a psychotherapist, so I referred her to the psychotherapist, and she's doing talk therapy with her. And she got a lot better after just like 3 or 4 sessions. She came back to me. She was like, the stress is so much better, the anxiety is so much better. And that also reflected on her blood pressure. The same happens, for example, in people with gut issues. When we kind of treat their mental illnesses, when we kind of treat their anxiety, the gut issues get a lot better. So yeah, there are a lot of examples.
All right. So, and now, what kind of advice would you give to the young medical professionals in the field?
So I kind of encourage them to, if they're interested in mental health, to get into the field, because mental health conditions and disorders are becoming more common nowadays. They're kind of the epidemic of today. So we need more healthcare professionals interested in mental health. We need more healthcare professionals opening up to conversations like this around mental health, around holistic health. Yeah.
And for our last question, if you don't mind, you look into the future or looking into the future. What are your goals for your practice? And do they include mental health advocacy?
For sure, for sure. I kind of, my goal in the future is to integrate mental health and physical health together. And we already do that, but I kind of aspire to have much more and more integration and more awareness in our field as doctors, and because I feel like it is important that this awareness becomes more common within our field. And I also aspire to use social media as a as a platform to do that as well. Yeah.
Thank you very much, Dr. Saad. This has been an amazing interview, and we really enjoyed it.
And also, it was very knowledgeable. I would say that we get to learn new stuff with every guest, with every episode.
Yes.
And yes, with that said, we have reached the end. Thank you so much for being part of this interview,
Thank you,
Dr. Saad. And of course, dear viewers, stay with us. We will take this quick break before we wrap the episode. And now, dear viewers, we reached the end of this episode. We hope that you enjoyed every bit of it, because definitely we did.
We did.
And Dr. Saad was very informative. He was calm. He was very nice in the way like he provides the message and the stories that he got for us. So it was a very nice interview, actually.
It was, and I think one of our cameramen was like, you guys were very careful choosing your questions. I'm like, yes, we don't want to give misinformation about medicine, especially when it comes to medicine and learning how to have the best approach, the holistic approach, the way he was talking. We were actually listening intently, you and I,
Yes.
So yes, so we want to thank Dr. Saad Almasab for this fruitful interview, and we will see you on another episode of The Untold.